Hi, everyone. I want to welcome everybody as more people drop in. My name is Brian Cameron, and I'm a partner at Oatley Vigmond, and it's my pleasure this afternoon to co-host the 2021 Virtual Awards of Excellence. And I can assure you that while we may be virtual with respect to the ceremony, the excellence is very real. And I'm happy to host this along with the PIA, my fellow PIA firms, and the Ontario Brain Injury Association. Now, Ruth is going to get the presenting started. And we all know Ruth has worked in the community services field for well over 30 years. She's the executive director of the Brain Injury Association and has been working with the organization since 2004. Her work with OBIA focuses on enhancing the lives of Ontarians living with acquired brain injury through education, awareness, support, and continuing to build an affiliate network of local brain injury associations and support groups across the entire province. So I'd like to welcome Ruth.
Thanks so much, Brian. Again, on behalf of PIA and OBIA, welcome to the Virtual Awards of Excellence. And I'm excited to say that we have been having these awards in collaboration with PIA since 2014. To those who are working in the field of brain injury and rehabilitation, who consistently provide exceptional service to the brain injury community. And we have 5 different categories of awards: the Hospital Social Worker Year of the Year, the Case Manager of the Year, Healthcare Provider, Rehabilitation Company, and Community Brain Injury Association. And the recipients of the awards were determined by the following: strong advocacy for the clients, positive outcomes for clients, years of service, credentials, number of votes, and supporting testimonials. But I can attest to, as I read the wonderful testimonials for all of the nominees, they were quite incredible and particularly moving. By many had their clients share what an impact they had made in their lives. And so I'm just so proud to be part of a community that does such excellent and quality work. And just before we begin, I want to say that a special thanks to PIA Law for working together and supporting OBIA to present such prestigious awards. So now I'd like to just turn it back to Brian, and he's going to introduce the Hospital Social Worker of the Year nominees. Brian?
Thanks, Ruth. On behalf of the PIA, we're of course happy to be involved in this and to recognize people, all the categories. And the Social Worker of the Year is one that's particularly important because it's usually the first person that the client sees that can help them get their life back on track. And for that reason, it's such an important role. And I see the role they play with all of my clients by the time they get to me. Now, the Hospital Social Worker of the Year Award recognizes the hospital social worker, either a trauma or a rehab hospital, who has consistently gone above and beyond the call of duty to help brain injury survivors and their families. And I'm going to read the nominees, and then Ruth is going to tell us all who won. The nominees are Tess Bardikoff, Holland Bloorview; Gail Clement, TRI; Chantel Grant, Royal Victoria Regional Health Centre; Julia Henderson, Muskoka Algonquin Healthcare; and Subo Cautamel, I'm sorry if I got that name wrong, TRI as well. And the winner is Ruth?
So the winner is Gail Clement. I just want to share with you a little bit about Gail. So Gail graduated with her MSW from the University of Toronto in 2002 and has been working in the field of ABI for most of her social work career. She works with patients and families by providing emotional support and counseling, assisting them in navigating the healthcare system, and working to ensure a safe transition home and to the community. Gail is actively involved in the ABI program, participating in a variety of safety and quality initiatives, and thoroughly enjoys working with an exceptional interdisciplinary team. Gail finds working in the field of ABI extremely rewarding and she feels privileged to work with patients and families during the inpatient phase of their recovery process. Gail, on behalf of PIA Law and OBIA, I want to congratulate you on your award.
Thank you so much. Thank you to Brian and Ruth, and thank you to OBIA and PIA Law for this award of excellence. I have tremendous respect for my fellow nominees and the work they do in their respective hospitals, and I'm honored to be among them in the category of hospital social worker. I'm going to repeat a little bit about what Ruth said, but I really do feel very privileged to work with brain injury survivors and their families. And I feel really grateful that I came upon this area of work early in my career, as it's been extremely rewarding, and I continue to learn so much from my patients and families. It is certainly a team effort at the hospital, and I am very fortunate to work with such a dedicated team of therapists and nurses at Toronto Rehab, who are very committed to helping our ABI clients during the initial stage of their rehab. So once again, thank you to OBIA and PIA Law for this honor. And thank you for being such key players in the field, working to better the lives of ABI survivors and their families. So thank you.
You are most welcome, Gail. So now it's my pleasure to welcome Lindsay Charles, who's a partner at the law firm of McLeish Orlando, and she's going to introduce the Case Manager of the Year Award. Lindsay?
Thank you, Ruth, and hi everyone virtually. It's nice to see you. I wish it was in person. So for the Case Manager of the Year, this recognizes a case manager who works in private practice, who has consistently gone above and beyond the call of duty to help catastrophically impaired brain injury survivors and the families. The nominees for this award are Mary Anderson from Kids Community Health Services, Catherine Obey from Abilities Rehabilitation Services, Nina McQuiggy from Innovative Case Management, Victoria Sweetman from Victoria Sweetman Rehab Consulting, and Claire from Rehabilitation Resource Management.
Thanks so much, Lindsay. And the recipient of the Case Manager of the Year Award is Mary Anderson. So I just want to say a few words about Mary. She has over 30 years experience providing case management, consulting, and school integration services in the community, and is the owner of Kids Community Health Services. She has been a leader in her field with respect to integrating children and youth into the school system. She is a strong advocate for her clients and their families, incorporating their diversity and cultural differences into treatment goals. One of the things about Mary is her sense of humor, which has been a real asset in promoting a comfort level for her clients and colleagues. Mary, on behalf of PIA and OBIA, I want to congratulate you on receiving this award.
Thank you, Lindsay and Ruth. I would like to thank the Ontario Brain Injury Association and the PIA Law Group, Otley Vigmond, McLeish Orlando, and Thompson Rogers for this tremendous honor as Case Manager of the Year. I'm delighted to be nominated amongst such deserving colleagues, Catherine, Nina, Victoria, and Clara. This is a great moment for me, one that I'll always cherish. I extend this recognition to my team members who I count on, learn from, respect, and appreciate tremendously, because my successes as a case manager have been possible with contributions from my valued colleagues. I thank my clients and their families who have trusted me and allowed me into their lives and homes to be able to facilitate their path of recovery. I continually learn from them. I would also like to thank my mentors, Dr. Marlene Jansen-LeBur, Marjorie Bogart, and Marlene Moss, who have supported me and offered wisdom over the years. I offer tremendous gratitude to my support staff, Rochelle and Sarah, Katrina, who keep up with my pace and keep me sane. With great affection, I would like to thank my daughter, Laura, who has been understanding, supportive, and accepting of my passion to be helping my clients to the very best of my ability. As I contemplate my journey as a rehabilitation nurse case manager, I am reminiscent of a time period of many changes, challenges, increasing knowledge, understanding, and an evolution of optimism. In earlier days, the knowledge and understanding of brain injury is not where it is today. As we all know, providing rehabilitation for catastrophically impaired brain injury survivors requires expertise, innovation, compassion, creativity, strength, and at times a sense of humor. When life becomes intense, our clients appreciate permission to laugh and to be able to look at situations on the lighter side, as it is a difficult road to tread. During my career, I have valued the importance of continually learning, improving my knowledge and skills. This has enabled me to educate others and become a strong advocate for my clients, offering me great satisfaction and purpose. Once again, I'm grateful for the acknowledgement as Case Manager of the Year. To be chosen amongst individuals who are leaders in the field is humbling and a great honor, and I extend my heartfelt thankfulness to all who have been part of my journey. Thank you.
Thanks so much, Mary. You know, I was thinking we should have like fake clapping or something, because when we do this in person, of course, we clap for the nominees, we clap for the winner. And so I'm sure though we're all clapping in our hearts, and thank you for the lovely comments in the chat. I know that they are well appreciated. So now it's my pleasure to introduce Stephen Berman, and he's a partner at the law firm of Thompson Rogers. And Stephen's going to introduce the Healthcare Provider of the Year nominees.
Thank you, Ruth. The Healthcare Provider of the Year award recognizes the health practitioner that has consistently gone above and beyond the call of duty to assist the brain injury community. The recipient may be in the public or private sector and can be from any discipline, such as physician, speech-language pathologist, private social worker, occupational therapist, psychologists, physiotherapists, to rehabilitation support worker, personal support worker, etc., etc. There are more nominees for this award than any other award, and frankly, there are not enough nominees because there are so many of you that truly deserve to be recognized. This year's nominees are Sheila Dawn, Innovative Occupational Therapy Services, Maxine Fife Roberts, from Essentially You, Carol Gore, Abilities Rehabilitation, Joanna Hamilton, Private Practice, Alana MacIntyre, Insight Rehabilitation, Shannon Orr, Complex Injury Rehab, and Kindry Rowland, Orangeville Speech and Language Clinic. And Ruth will present the winner.
Thanks so much, Stephen. And so this year, the recipient of the Healthcare Provider of the Year is Alana MacIntyre. So just a little bit about Alana. She's a speech and language pathologist who works in Northeastern Ontario, and she's worked in the field of brain injury for over 27 years. She travels extensively across Northeastern Ontario to service clients from Wawa to Sault Ste. Marie to the communities in the corridor of Sudbury and all of Manitoulin Island and the corridor of North Bay. I remember once chatting with Alana at an event, and honestly, when she shared how much she travels, I got tired just listening to how much traveling she does and how much time she spends in her car. But she really does go above and beyond her role, which is evident in her daily practices. She's recognized for her strong work ethic, client-centered functional approach, and passion for the work that she does. And I want to also mention that she's been involved with the Sault Ste. Marie and Area Brain Injury Association for over 10 years and has been instrumental in helping to expand the association's role within the community by developing relationships with other providers. So Alana, it is my pleasure now to hand you your award.
Thank you so much, Ruth. That was very kind words. I really want to thank both the OBIA and the PIA for this incredible honor. The other recipients or the other nominees in this award I can't believe their incredible talent. But there are a few people I would like to thank in particular. And the first group of people that are the most important to me, I guess, are or have had the greatest impact on me and have made this award possible are my clients. And allowing me to be part of their recovery journey. They've taught me compassion and empathy and promoted a love for what I do. And I'm really fortunate to have met them and been part of their lives. I also really want to thank my family. As you mentioned, I do a lot of traveling and my family have been so supportive with the many, many trips that I take away from home to service my clients across Northern Ontario, as well as my late nights finishing reports that seem to never end, which I'm sure everybody can understand. And the phone calls that come at all times, days and nights, they've always been understanding. They never complain, and they always give me the time I need and support me completely. Finally, I'd like to thank my colleagues. In Northern Ontario, we don't always have the privilege of having people right there next to us. And my colleagues in Northern Ontario have always taken my phone calls. They always answer my questions. They never seem to tire of my many questions, at least that I know of. And having supporting me and in turn supporting my clients, they've shared their knowledge and their expertise, and I can't thank them enough. Without all of these people in my life, this award would never have been possible because I would never be the clinician that I am today. And really, this award belongs to everyone and all of them for helping me achieve this. So thank you very much.
You're most welcome, Alana. I'd like to welcome back Lindsay Charles, and she's going to introduce the Rehabilitation Company of the Year. Lindsay?
Thanks, Ruth. The Rehabilitation Company of the Year award recognizes the private.
Okay. It was kind of short.
There we go. The Rehabilitation Company of the Year award recognizes the private rehabilitation company which consistently provides exceptional and dedicated service to brain injury survivors, including volunteer work by its personnel. These organizations are hugely important, and we appreciate the work that everyone does. So the nominees for this award are the Acquired Brain Injury Outreach Network, Inc., BrainWorks Rehab Services, Elements Support Services, Functionability Rehabilitation Services, iScope Concussion and Pain Clinics, and Wright Rehab.
Thanks, Lindsay. And the recipient of the Rehabilitation Company of the Year is Wright Rehab. I just want to say a few words about Wright Rehab. When John Wright started his team in 2002, it really was from a philosophy that puts the rehabilitation needs of the individual first. Their vision in 2021, they renewed their vision, which is to empower people to be their best right now. Their leadership team works diligently to share tools and resources and coaching and regular clinical support and supervision to rehab therapists, social workers, and attendant care specialists. Wright Rehab wants to acknowledge and applaud the incredible and tireless support of their team members so that they can provide quality service to their clients. I also want to thank Wright Rehab for your continued support to the ABI community. So now it is my pleasure to introduce Dana to you, and Dana will be accepting the award on behalf of Wright Rehab. Dana?
Thank you so much, Ruth, and the committee from the Ontario Brain Injury Association, as well as the Personal Injury Alliance. We are so honored to be among all of the other amazing companies nominated this year. A huge thank you goes out to our Wright Rehab associates, the rehab therapists, social workers, and attendant care workers across Ontario who've made the choice to join our team, our family, centering their work around the clients, providing compassion, empathy, and clinical expertise to change so many lives. We know that the last 18 months has not been easy, but by being committed and creative, our associates continue to show up for our clients' journey every single day. As Ruth said, 20 years ago, John Wright had a vision to support clients with compassionate, respectful, and highly clinical approach. And when John passed just over 11 years ago, we made the commitment to continue to carry out that philosophy to honor his legacy, striving every day to make a difference in the lives of the clients that we serve. Daily, I am reminded of his work ethic and a commitment to clients with acquired brain injury. And I know he would be so proud of the unwavering excellence in therapy that our team provides every day. Again, we are so pleased and grateful to receive this year's award. And on behalf of our leadership team, Dana, Danielle, Ashley, and Alex, and most importantly, our associates, we thank our industry peers for this recognition. And finally, OBIA and the PIA for the wonderful work you do to bring awareness, support, and education to the clients and the ABI community. Thank you.
You are most welcome, Dana. So I'd like to welcome back Stephen, and he's going to introduce the Community Brain Injury Association nominees.
Thank you, Ruth. It is my pleasure to announce the nominees for the final award of the evening, the Community Brain Injury Association of the Year. The award recognizes the nonprofit Brain Injury Association, which provides exemplary service to the brain injury community and continues to find innovative means to support brain injury survivors and their families. The four nominees are Brain Injury Association of Niagara, Brain Injury Association of Waterloo-Wellington, Brain Injury Association of Toronto, and the Hamilton Brain Injury Association. And Ruth will announce the winner.
Thanks so much, Stephen. Well, first of all, before I announce the winner, I want to say that all of the associations across the province have done a phenomenal job, and many of them on shoestring budgets to support people living with brain injury. So congratulations to all the associations, specifically the nominees, and then the recipients. And I say recipients this year because this year is a bit of an exception as we have two winners. The committee felt that both these associations deserve the awards. And so we have two recipients this year, which is the Brain Injury Association of Waterloo-Wellington and also the Brain Injury Society of Toronto. So first of all, the Brain Injury Association of Waterloo-Wellington, this association has made incredible strides, particularly after numerous difficult years, and has come back with even greater strength. Like many of, well, all of us actually, they were challenged in the wake of the global pandemic to support their members, and they pivoted to a robust virtual platform. So in addition to their ongoing virtual and phone support for supporting over 500 people in their existing programs and their Lids on Kids program, which they distributed 1,250 helmets to children just in the year of 2021, they recently introduced four new programs, which is Brain Connect, providing technology, devices, and training, Brain Access, which is tax filing support, Brain Makers, which is social enterprise arts, and an intimate violence program. Also, they have a greeting card program in which in 2020, they made and sold over 6,000 greeting cards. And then this year, they also made 700 masks to individuals in need and distributed to individuals in need since the pandemic. So congratulations on your great work. And Linda, I am very proud and pleased to hand you this award of excellence.
Thank you so much, Ruth. As Ruth mentioned, it's been quite a year. We've been working over the past 4 years to reestablish the Brain Injury Association here in Waterloo-Wellington. I'd like to congratulate all of the associations nominated. All are very worthy of this award. This is a team effort and a team win. I'd like to personally thank our supportive board of directors, our dedicated staff, our amazing volunteers, and especially our members. Thank you to our families, our sponsors, our donors, and everyone who's contributed to our growing organization over the past few years. We just can't do it without you. With input from all of these groups, we are shaping the programs and services to not only meet the current needs for our community, but future needs as well. We are thrilled to be one of the winners for OBIA and PIA Law's 2021 Award of Excellence for the Brain Injury Association of the Year. Thank you to all who took time out to vote for us and to provide such heartwarming messages. thank you to OBIA and PIA Law for providing these awards.
Thanks so much, Linda. So as I mentioned, the next recipient is the Brain Injury Society of Toronto. And BIST, as we generally know them, was established in 2004 and supports people living in the city of Toronto. BIST is focused on providing a safe space for persons with brain injury and their families to connect and to socialize and to learn. They are also very invested in supporting the most marginalized in our community through their homelessness, poverty, and intimate partner violence initiatives. And they are committed to partnerships and being a voice for change, and are involved in projects and committees related to ABI and the justice system, including the Toronto Police Disabilities Consultative Committee, 2 focus tables, and which includes City of Toronto, United Way of Toronto, and Toronto Police Service initiative that really aims to reduce the risk, harm, crime, victimization, and improve the community. They also have developed a website called ABI Justice, which is the first and currently the only resource in Ontario that aims to decrease common barriers persons with brain injury encounter with legal matters. So, Melissa, on behalf of PIA Law and OBIA, we are pleased to present you and BIST with this award.
Thank you so much, Ruth. So congratulations to everybody who won tonight, and specifically to all the brain injury associations. As co-chair of the OAC, I see how hard all the associations have worked throughout the pandemic. The passion for what they do is very apparent, and I agree with Ruth that all the associations do deserve the award for the hours that everyone has put in. I do want to thank PIA and OBIA for this award, and not just for this award, but for all the support that you provide us and all the associations throughout the year. We know we couldn't do the work we do without your ongoing support, so thank you for that. Obviously, I am a person here representing BIST, but BIST is many people, and I'm very grateful for the staff we have on board. I always say BIST is small but mighty. We have a tiny team who works so hard, who really get out in the community. They talk the talk, they walk the walk, they meet with our members wherever they are to provide the support that they require. Obviously, we have a very supportive board of directors who we thank, and we also thank our members who contribute so much to our community. We had a virtual expressive art show this year that ran across the country. We had over 100 participants share their art and their experience of having a brain injury. They also consistently reach out to other folks in their world and bring them to our community. So we're very grateful for our members, for our staff and our board of directors, and of course to OBIA and PIA. So thank you.
You're welcome, Melissa. Brian?
Thanks, Ruth. Thanks, Linda and Melissa. I want to thank everybody on behalf of the member firms of the PIA, to all the award recipients and all the nominees, and to indeed everybody else who does this kind of work is with us today. I'm hoping that this is the last year that we have to do this virtually, because all the nominees and all the recipients and everybody else deserves, I think, more recognition for what you do. We're very thankful, of course, for the people who joined us today as well. And so we've decided we're not together. And so we've decided to donate, I think it's $25 each for every person who registered to the Ontario Brain Injury Association and the Toronto ABI network. So the total donation the PIA is happy to make is about $8,000 for both groups. And we're very happy to do that to help them support the day-to-day work they do with brain injury survivors. So with that, thank you very much. I'm going to throw it back to Ruth for a few closing comments. And once again, congratulations to everyone.
Thanks so much, Brian. And thank you to PIA Law for making the donations to OBIA and to the Toronto ABI network. They are so needed and so appreciated. I want to just close by truly giving my heartfelt congratulations to all who were nominated and to those who were the winners. And I have to say that I'm so proud to be part of a community that genuinely cares for those who have sustained brain injuries and their families. I agree with Brian. I hope that next year we can do this in person, where we can see each other, where we can shake hands and hug and connect once again. But until then, we do it virtually, and a special thanks again to PIA Law for making these awards possible, and again for your donation to us and the ABI network. And I'm just going to say just very quickly, don't forget to register for the Provincial ABI Conference, which was virtual this year, and it's October 28th and 29th. So please register, and we hope to see you there. And thank you everybody for joining. And if you see the wonderful pictures of our nominees and for the awards, and it indeed has been quite the last year and a half, but hopefully upwards and onwards, and wishing everybody health during this challenging time. Take good care, everyone.
Bye, everyone.